Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about knee pain, which is all too common. I see it quite often in the practice, and quite frankly, we do really well with knee pain. There are certainly some situations where we do not, where arthritis really is the underlying problem, but I will tell you 90% of the time, somebody comes in telling me that it's arthritis causing their problems, and 5 visits later, they're pain-free, which means it wasn't the arthritis, it was one of the other myriad of pain generators around the knee. So before we go on talking about how mismanaged knee pain is from a primary care standpoint, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So that being said, this was a study out of the University of Pittsburgh. They looked at the records from the referral patterns for people that came in for knee pain for it was about a year or so, and there were almost like 90, a little over 9,800 people that presented with knee pain. 65 years of age was the average age. 75% were overweight or obese, which definitely plays a role. Didn't really need somebody to tell you that, but more stress on the knee is obviously more of a problem. So they looked at the referral patterns for physical therapy. Now, obviously as a chiropractor, I have my biases, but I also have my biases against my colleagues. I think just adjusting is not going to do anything for the knee, and neither is strengthening plays a role, but neither is a lot of the stuff that's done in rehab. So I'll get into that when I talk about the 5 tips about what to do. So what did they see as far as referral patterns? Because generally, you should refer out for some type of physical medicine before you do anything else. And those are pretty well accepted standards. So, and sooner is better than later. So we don't start with, drugs and injections. We start with physical medicine. And they found that ultimately, only a quarter of the patients were referred for physical medicine, for PT, mostly by ortho, rarely by primary care doctors. And again, earlier is better, so only 17% were referred within that 2-week period of time. So really it's, hey, my knee hurts, take this. Nothing that they're going to do in a primary care doctor's office is going to fix it, but hey, let's try it and calm down the inflammation. Don't fix the problem, we'll just calm down the inflammation and we'll see how you feel in a couple weeks. And if you're not better, we'll refer you out. Well, that never, I don't want to say never, rarely fixes the problem. So 75% of the people in the study were never referred out. Instead, what were they given? They were given recommendations for injections, think steroid injections, or viscoelastic, viscous gel, so hyaluronic acid, Synvisc, something like that. Injections of steroids, which is the data is not very strong on, and they actually every indication that they will destroy the knee long term. So, and I have patients come in. It's not 1 or 2 or 3 injections. They've had 10 over the past myriad or a handful of years, or they were given over-the-counter pain medications. Think Tylenol, ibuprofen, naproxen. I'll leave that category. I've made it very clear how strongly I am against these. I personally have not taken anything like that in 30 plus years, if not longer, despite several meniscus injuries to my knees, and I just don't feel a need for it. So ultimately 0.3% of the people, of these 9,800 people, were told to exercise more and lose weight. So drastically mismanaged in the primary care doctor, even the ortho world, even though ortho world is a little bit better, but it's because they understand that really it's either surgery or something else. So one of my 5 tips. Number 1 is move more. I know we typically go the wrong direction. Something starts to hurt and we start using it less. Hey, I'll stay off of it for 2 weeks and see if it gets better. It is almost never the case, unless maybe you've had a serious injury, ACL tear, something like that. But even with meniscal tears, movement is generally helpful. So That can be walking. Generally, the more steps people take, the less likely they are to need a knee replacement. Strength training, the stronger your quads are, the better off you're going to be. So that's actually hitting the gym to strengthen those quads. So that's step number one. You have to move more. Unfortunately, most people go the opposite direction. Maintain an ideal body weight, or achieve an ideal body weight. That's a tough one, but I guarantee you the less you're moving, the harder it's going to be to get there. So ideal body weight, that makes common sense. Just less stress on those knees will be more helpful. An anti-inflammatory diet. So there's a lot of people that change their diet and have less inflammation, and their joint pain goes away, including the knees. My strong bias is you need to find somebody that's competent with soft tissue work around the knee. Generally, I prefer instrument assisted. I feel that that's probably one of those powerful tools, especially if somebody's having like pain on the inside part of their knee, the medial collateral ligament, or pain around the kneecap. Soft tissue methods are some of the most powerful tools to treat knee. It's not adjusting, it's not exercises, it's not ultrasound, it's not interferential. In my opinion, getting in there and working the soft tissues and getting them moving again is the most powerful tool and works well with everything else. So if I'm working on somebody and then they go back to sit on the couch, probably not going to be nearly as effective as if they use that to continue moving. And I've already mentioned it, but number 5 is really avoid steroids, avoid anti-inflammatories, over-the-counter or prescription. They don't do anything good. The data is all relatively weak, and it's short-term, and it will, I'm extremely confident that makes things worse in the long run. They are certainly not fixing the problem. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.